Kia ora
Kia ora
koutou.
tātou.
And kia ora whānau. My name's Zoe Tipper. I'm the Chief Nurse for Whānau Āwhina Plunkett. And welcome to our Facebook Live chat today to talk about whooping cough. I have the pleasure of welcoming and introducing Dr. Owen Sinclair as our subject matter expert today. And Owen, I'll pass over to you to introduce yourself.
Yeah, kia ora, Zoe. Tēnā koutou everyone. Ka Owen Sinclair taku ingoa. I'm a Māori paediatrician based in Te Whatuara Waitemata at Waitakere Hospital. I'm chair of the National Immunization Task Force and president of the Paediatric Society, but no one calls me chair and president, and they seem to drag me up whenever there's questions about immunisation. So more than happy to ask have any korero, have any pātai today, bring it on. So yeah.
Kia ora, thank you, and thank you, Mr. Chair, President, and Doctor. So, as I said, today we're going to be discussing the whooping cough epidemic that's been declared across Aotearoa, and we're going to be covering a bit about what a whooping cough is and how it's spread, the difference between whooping cough and a common cold and how you might be able to tell, what to do if tamariki or pēpi are unwell, how to protect yourself and your whānau, and who should get immunised and where and when. We've had quite a few questions sent through already, so we'll do our best to answer as many as possible in the half hour we have together. But if we're not able to get to your pātai today live, our team will do their best to answer in the comments later today. So we'll get started. So the first question, what is whooping cough and why is it an epidemic right now?
Kia ora. Yes, so whooping cough is a disease an infection of your lungs with the bacteria pertussis, and so the pertussis it's highly infectious. It's so everyone remembers R values for COVID. When COVID had an R value of 1.7, whooping cough has a value of between 18 and 24, and that means if you're in a room of people with who are unimmunized or not immune to pertussis, and you chuck someone with pertussis in, 18 to 24 of those people will get infected in that thing. It's that thing.
Wow.
It is incredibly deadly. It is the only disease, only vaccine preventable disease that still kills pēpi in New Zealand. So we had 3 pēpi die of it last year, and it's really nasty. So what it does, it gets into your lungs, and in your lungs there are these special cells, and they've got hairs on them, and they pull up all the stuff out of your lungs. It's called the mucociliary elevator. And your lungs always turning over cells, so you need this to get ready. The pertussis comes in, grabs those hairs, infects the cells, and kills them. And so the first thing that it does is makes you cough a lot because you're not clearing your lungs. And in the earliest description of pertussis, a Chinese person called it the 100-day cough, which is pretty accurate. In the worst cases, all of those cells get killed, your lungs fill up with fluid, and it happens in pēpi, and you die essentially. And there's nothing you can do once you've got it. And so the whoop from whooping cough is from a baby breathing in, and they go like this, and they breathe in to get their breath after this prolonged period of coughing. They cough and cough and cough, so they cough out all the air and the oxygen, and then they have to breathe back in, and that's what the whoop is. So it's an extremely nasty disease. It's one you don't want to get, and no one wants to get it. Adults can get very sick from it as well and have long periods off work, but it can kill pēpi, unfortunately.
That's horrible. And it's I had no idea that it was that much more contagious than COVID. I just had no idea that it was, that's what, nearly 3 times more contagious.
No, 9 to 10 times more contagious.
10 times, is it? Oh,
yeah. So whooping cough, measles, and smallpox are probably the most infectious diseases known to mankind. So they're really bad. Yeah.
That's why we're so worried about it spreading, and we're worried about an epidemic. Yeah.
Okay. Oh, so the epidemic question, we don't have any idea why epidemics come. Every 3.7 years on average, there's a spike in epidemics in whooping cough. So we understand the concept that if a bug comes in and you haven't got the disease, you will get infected. That's a relatively accepted thing, but we don't know why there's a peak and it stops. So this epidemic will stop. They always stop. We don't know why that is, and we don't know quite why it's dormant for a period of time and then you get the spike again. It's a bit of a mystery.
So a lot of people talk about the epidemic starting because of the low immunisation rate. Do you think that that's had a contribution towards it happening now, or is it just they happen anyway?
Yes and no. Yes, so they would happen anyway, but the peak would be much lower if
Right.
you had everyone immunised. So that would be every hapu mama immunised and every pēpi immunised at 6 weeks. The peaks would be much lower. There are some problems with the pertussis vaccine. So some vaccines, like MMR, which has got measles in it, if you get vaccinated with that, you're vaccinated for your entire life. Unfortunately, with the pertussis vaccine, that's not true. And there used to be one that did your whole life, but people didn't like it, so they've gone to another one. And probably the vaccine starts waning, the effect starts waning for most people in a couple of years. And that's why you have boosters at 4 years, 11 months, and every time you get pregnant. So it also means there's a reservoir in the community. So 100% immunisation is very, very hard to do. No one does that. Places like most third world countries get close to it, but unfortunately in New Zealand we don't. Did that answer the question?
Yeah, I think so. Yeah, definitely. Why it's an epidemic right now. So one of the questions we've been sent through already is, what should I do if I think my tamariki has whooping cough, and how can I tell if it's that or just a cold?
Yeah, at the beginning it's almost impossible to tell when they present in almost identical ways. So you'll notice your pēpi getting unwell, getting sick, starting to have sneezes. It presents the common cold and whooping cough essentially presents in exactly the same way, and that's really annoying, isn't it? You know what I mean? So there's no real way of telling, and we can't tell either often. And so when pēpi come to hospital and the history of this thing, particularly if they got a cough, we tend to test them, particularly in epidemic times and all that sort of stuff. So the answer to that is in the early stages, you can't tell. As the disease progresses, if it is whooping cough, pēpi almost certainly will start to cough a lot. And that will cause colour change. And so they will cough and cough and cough. The first, they won't cough till they go red in the face. And then as it progresses, you will cough and you will start going blue, like that sort of thing. So, yeah, this is a difficult one. So the people that are most at risk and need to seek help if in the early stages are Māori and Pacific pēpi, who are at much higher risk of the disease for a number of reasons. You need to seek help if you were unable to get a vaccine in your pregnancy for whooping cough. You need to seek help if your baby's younger than 6 weeks earlier, because they're not old enough to get the vaccine, and also if they're young as well. Just young in general. In an epidemic situation, if in doubt, come and see us, and we'll sort you out if you're in one of those groups, and take you very serious. We hate this disease because once you get it, there's nothing you can do about it. So yeah.
Nasty, eh?
Yeah.
I heard about a rat test that you can do. Is that true that there's a rat test out there, or like a similar to COVID testing? I don't know if it's true that there is a rat test out there to test for whooping cough, or whether you can use it for children as well. It was just a rumor, through the nurses.
If there is one, we don't have it in New Zealand. We do a swab and we send it to the lab. Right. And they do something called PCR on it, which is a genetic test for the thing. So, so annoyingly, that can sometimes take a little while to get back, and so you can sit in hospital for a bit. A rat test would be great, wouldn't it? Yeah.
Yeah, it would be good, especially given how contagious it is as well.
Yeah, crazy stuff. Yeah.
Yeah. Okay, so have you got any tips for how we can care for a pēpi or tamariki with whooping cough as well?
Yeah, so unfortunately for whooping cough, there is no treatment once you get it. So the care is all supportive. So if we have a pēpi and baby who's coughing so bad that they go blue, we sort of cough and cough, they cough and cough and cough, and then we sort of sit them up, and sometimes we put their hands above their head, and we put a mask of oxygen over the mouth. That's supportive treatment. We would sometimes give them ways to we might put a drip in and give them some fluids because they might have trouble feeding. And unfortunately, if they're really bad, we'd send them to PICU ICU to go from there. This really is a disease you want to avoid getting rather than get it. It's nasty, nasty stuff. Yeah.
Sounds like the majority of babies that do get it end up in hospital. Would that be fair to say?
Yeah, no, not necessarily. So the majority of babies who get it will be a mild to moderate illness, and they won't have to stay in hospital for very long at all.
Right.
But then there's a group of babies who get it very seriously by that at all. But you don't really want to take the risk, in my opinion. The vaccine is 100% safe. And so so the majority of children, there's probably a group of children who get it and they don't even come to the notice of it as well. But we don't really know that because we're not running around testing everyone in the community to see who's got it. But if you've got symptoms, especially if you've got symptoms, especially if you're coughing a lot, you probably do need to go see someone if you've got a young baby.
Yeah, fair enough. When would you call 111?
For all of the reasons that you would call 111 in any other situation. So if your baby was coughing to go blue, you probably do need to call 111. Or if it's quick, if you just live around the corner from the hospital, go there yourself per se. So that's the thing. So, but I think that statement's true in all situations. If your pēpi's going blue for some reason, it's time to. That's absolutely a time to call an ambulance. Yes.
To move.
Yeah,
absolutely. We've already had quite a few questions about how effective the whooping cough vaccine is, and you just touched on that it's 100% safe. Can we go over a bit about how it works?
The vaccine, yes. So it's so the vaccine is just particles of. So it's a acellular vaccine. So previously most vaccines are whole cell vaccines. So you basically get the bug and rip bits off it that aren't going to hurt you when you put it in, and that will stimulate your immune system to do it. This one's an acellular vaccine, so it's a synthetically produced protein that's similar to the pertussis bacteria, and it teaches your immune system to fight the pertussis if it ever meets it, which is how all immune things work. So once you get a common cold, your body would then recognize that one, and if you ever get that bug again, it's fine because your body's ready to go and will kill it. So the immunizer, it's really what's really important in the concept in the immunization for pertussis is you need to get everything done on time. So and the first one, so we'll start with the childhood one because everyone knows about it. So the childhood immunizations are 6 weeks, 3 months, and 5 months. And so the longer you wait for that sort of thing, the longer baby is unprotected from it. So the first dose, which is at 6 weeks, gives you 68% protection from getting pertussis, but probably much higher rates from actually having to come to hospital. The second dose at 3 months gives you 92%, and at 5 months it goes up to 98%. So you need to get them all done, bang, bang, bang. Certain groups who do this very well, the population in our motu who has the highest rates of immunization are those families who have heritage in Asia, and they have very high rates of immunization. And literally what they do on the way home, before they leave hospital with their baby, they're ringing up to make a booking to get their immunization done the day baby turns 6 weeks of age. And it's especially important in an epidemic. The second thing you can do to protect your pēpi is if you're hapu, you get immunized during pregnancy. And that can be from 13 weeks to 38 weeks. So you've got 25 weeks to get it done, which is great. And there's lots of options where you can go to. At 7 p.m. On a Saturday, there are plenty of pharmacies that are open that'll let you do it. And that gives you 95% your pēpi. That protects your pēpi for 95% from dying and about 80% from going in hospitalization. So if you do all of those things, you really are protecting your pēpi really well and putting their health, which is all of our things we're worried about, really front and center. Yeah,
that's great. And I guess just a reminder too that you need a booster each pregnancy. Is that right? So every time you get pregnant, you have another one.
That's correct. Just they're free. They're easy to get. Pharmacies throughout the motu do it. Not every pharmacy, but I'm sure if you went to a pharmacy, and they would know. There are also places online you can go to. A really good thing is Health Point, if you click on Health Point, click on vaccines, click on maternal vaccines, you can type your address and it'll tell you how far away you have to go to, and it's normally just down the road.
Oh, that's great. So I think you touched on this already. Someone asked, is one dose of the vaccine enough to protect pēpi? And you were saying that it's not, because it builds on each one, isn't it?
But one is massively better than none. So like
nothing.
that sort of thing.
Yeah, absolutely. Who else should get immunised in a whānau?
Yes, it's a really good question, and people are pushing for it a lot. There's and if it gets done, that's fine, kei te pai. But my answer to the question, the focus needs to be on the mother and the child. So there is some really good data on immunising the family who live around the child, and it doesn't seem to actually confer that much protection. And it's probably because, like if you get the measles vaccine, wipes it from your body, you don't carry it on your body. The pertussis vaccine doesn't. So you can, it will stop you from getting infected, but you may still have it in your nose or your saliva, which is probably the reason. So the focus should be whāmaker considering whether family members do it. And if they say yes, then I would go and do it. It's great. But it's the focus needs to be on pēpi and mama to get it done as number one. Yeah.
So it's more of that personal kind of immune response that you're trying to generate by getting immunised. Yeah. Cool. We have had several worried caregivers ask if fully immunised tamariki and pēpi can still catch whooping cough.
Yes, it's not 100%, and it wanes, and that wane happens at various rates for different people. However, the evidence is really clear that if you're immunised, it basically stops you from dying. Even if you get it, it will be a much milder illness that you have. So your body is still sort of primed and ready to go to fight the bug when it comes along. Yeah. Sure.
We've had a question from the audience. You say that the vaccine's 100% safe, so there's no side effects at all.
That's correct. So no side effects from the vaccine. So there are side effects as there would be with any injection. So the side effects are there's a bit of pain. Sometimes there's a bit of swelling. But some of the other vaccines have been associated with some what was I going to say? With some thoughts of side effects. There's the most famous one is MMR and autism, which of those have been proven over again. There are no known side effects for the pertussis vaccine, and we've been using it now for 18 years, like that sort of thing. And the reason for that is the reason people think that there must be is that because most medicines are artificially made and they come into your body, and even things like paracetamol, there are side effects. But this is actually not medicines. This is immunotherapy. This is replicating a process that was going to happen anyway. If we didn't have vaccines, all of us would encounter the pertussis bug, all of us would develop immunity, and this is just mimicking that completely natural process. And so, no, there are no side effects of the pertussis vaccine.
Great. Another question is, how do I keep my new pēpi safe during this whooping cough epidemic? So I'm assuming under 6 weeks old. How can I check whānau are immunised without it being awkward? And you kind of touched on that before, but have you got any tips for how to have that conversation?
Yeah, no, that's a difficult question, isn't it? Because we all want our pēpi to be safe and all that sort of stuff. So if you've done the mahi and been immunised in pregnancy, and your pēpi has had it at 6 weeks, but you still really don't want pertussis coming into your health in any way, shape, or form. Because of the waning nature of the pertussis vaccine, even if people are fully vaccinated, it could wane in 3 to 4 years. So there's no real way to fully protect them. But if you've had it in the one in the thing, if the one in the chat is if the hapu mama had their vaccine and pēpi had their vaccine, the chance of them getting stuff is really low. I can't tell you it's zero, like that sort of stuff. But I wouldn't lock pēpi in a room and not come out, and that would be bad for both pēpi and mama. If you want to avoid people contact, I totally get it why you're concerned. You still need to go outside and walk around. Very hard to get it in the open air. You need social contact to keep yourself well as well. So you need to do it. If you need to do it in a safe way, don't become a hermit, I suppose, is what I'm trying to say. Like that sort of stuff. And I don't know if there's a very good way of knowing, of saying to people. You probably just need to ask them and say, look, I'm really worried about my pēpi. Is there any chance you have whooping cough, like that sort of stuff?
Yeah.
I don't. It's going to be, some people might be confronted, but probably your pēpi is more important.
Yeah, absolutely. And I think, it's become more and more normal to kind of ask if anyone's sick before you go and visit or anything like that, just because generally there's so many bugs around, and especially during COVID, we kind of learnt a few things around social distancing when people are sick.
So I had a godchild born, and I had a cold, and I didn't go to see them. I stayed away. For that perspective, because I knew I've got 20 years to catch up, you know what I mean?
That's right.
I have now had cuddles. Yeah. I've now had lots of cuddles with Amelia, so yeah.
That's right. Another question from the audience. It says that babies under 1 can get very sick, and does that apply if they're immunised? It's from a worried mum.
If they're immunised, if they're fully immunised, it's basically no. So the biggest risk group is it's as young as you are. So 1-year-olds, it's uncommon for them to get very sick. The really sick ones occur under 6 months and even younger than that. So in the last 25 years, the sickest babies go to ICU, and there's only ever been one that's older than 6 months, and they were a heavily disabled child. So once you sort of hit the 6-month mark, you're looking at the very serious disease, the chance of that waning quite heavily. You can still get a bad disease, like you get bad flu. If you get the cough full on, it will still be nasty, but it's unlikely to cause you, it's almost impossible that it will cause you to go to ICU or to die once you're over 6 months. So
Great. Someone else has asked, are you able to get a booster shot early? Say you have a 3.5-year-old, are they able to get a booster early?
There are rules about this. The answer is, if you've got someone who's willing to do it, the medical answer is yes. There is no reason to do it. There are slightly there is quite a lot of wobble in the 4-year vaccination. I think it's as much as 6 weeks earlier. One of the slight problems with it is a technical issue, and it's how we record the vaccine. You can't record it until a certain time point, so like this sort of stuff. But that's not necessarily. And for example, when we had a measles outbreak, we did break the rules, and normally the vaccine, the first vaccine, is at 12 months. We started making it 6 months.
Yep.
So if you've got a GP that's willing to do it, no, there's no medical reason why it can't occur, and it's more procedural. Yes, so can be done.
Shouldn't be a problem. Yeah, thank you. And just another question here from the audience: how long are people with the cough contagious for?
Yeah, so probably a couple of weeks. Often when people get whooping cough, they're given a course of an antibiotic, and it doesn't actually change the course of the disease, but it does reduce the amount of infectivity. So that's generally erythromycin is the disease you take. So you take I think it's a 7-day course. So if you take that, 2 weeks later, you're still coughing. Now you could still cough for it's called the 100-day cough for a good reason. And that's because of all sorts of reasons why you will cough as your lungs repair, and goes on and on. But you're probably only infectious for about 2 weeks. Yeah.
A couple of weeks. Okay. I haven't got any other questions from the audience, but I just kind of wondered if there any sort of, like, if you were asked, we've got a bit more now coming through. Hang on.
There is one there about accessing immunization. One way you can do it, so that the hapu mama, I've talked about going to Health Point for if you're a hapu mama. If you're Māori or Pacific, there are lots of community organisations that will do it for you, and some of them will even come to you. The way you do that is Google it. For example, I'm sitting in Te Whanau Waiparatus. If you're in West Auckland, they will do it for you, and they have pop-up clinics. The the vast majority of times is particularly for your Pākehā, is that you just make a booking at your GP as soon as your baby's born, so like that.
Great. Here's one. How is whooping cough transmitted? Is it respiratory, droplets, saliva? Should we be asking family to possibly not kiss our little one?
Yeah, it is through. It's the most effective way is through slobber, like that sort of stuff. So that's through that, but also respiratory droplets as well. It's incredibly infectious. Yeah, good question about the kissing, like that sort of thing. Admittedly, I didn't kiss Amelia, my goddaughter, when I had a cold. But you're missing the aotearoa then. You know what I mean? I think a completely asymptomatic person is probably at very low risk of causing harm, but if they've got any symptoms at all, probably shouldn't do that.
Yeah, it's tricky, isn't it? And when
yes,
they're little, they're all over your face anyway, and
totally.
fingers in your mouth, and
yeah.
Do you you know, if you had sort of one message around whooping cough, around the epidemic, around the vaccine, what would it be to whānau that are watching us today?
Yeah, so if you're hapu and you're over 13 weeks and you're out shopping in the mall and you see a pharmacy and you haven't been immunised, whip in, go to there. And as soon as your pēpi's born, make a booking to get them immunised. It's the day they turn 6 weeks old. Don't wait, don't do anything like that sort of thing. That's prevention is the only option for this disease.
Yeah, kia ora. Thank you. So I think we'll wrap it up there. Kia ora whānau, and thank you all for joining us today and for the thoughtful pātai that have come through. You know, look, we really hope this kōrero has given you some clarity and reassurance about how to protect your pēpi and tamariki during this whooping cough epidemic, and hopefully really to prevent, you know, the devastation, I guess, of any future epidemics. So a huge mihi to you all for your engagement and commitment to keeping whānau safe. And I also obviously want to extend my thanks to Dr. President Owen Sinclair for his expertise and for sharing such valuable insights today. And Owen, it's a privilege really to work alongside you to support the health and wellbeing of whānau. So kia ora.
No problem. Kia ora.
And if we didn't get to your question today, don't worry. Our Plunkett line nurses will be responding to comments throughout the afternoon. So if you watch this a bit later and put a question in, you can also reach out to Plunkett line 24/7 for free advice from any of our amazing nurses. So just give us a call anytime. And once again, thank you for your time, your pātai, your commitment to whānau wellbeing, and we wish you all good health and safety as we navigate this pandemic together. Kia ora koutou, mā te wā.